In my presentation is on ankle arthroscopy and its complications. Let's get started. So what is ankle arthroscopy? So ankle arthroscopy is a minimally invasive surgical procedure that doctors use to help treat problems in the ankle joint. So this has become super popular lately as more minimally invasive surgical techniques have been introduced. So ankle arthroscopy uses a thin fiber optic camera called an arthroscope that can magnify and transmit images of the ankle to a video screen in front of the surgeon. So many of the complications that are related with this surgical technique are due to a steep learning curve. One of the biggest challenges doctors face is a lack of preparation or teaching of this procedure, thus leading to the steep learning curve. So this procedure requires a very unique set of skill in which the doctor must be able to process the 2D image in the monitor in front of them into the 3D anatomy of the foot that he or she is actually operating on. So this is very different from open surgery in which the doctor sees the structures in front of them. There's a bunch of scopes, like different size scopes that we use for this procedure, but for the ankle, there's usually two common ones that are used. It's the 4 millimeter scope or the 2.7 millimeter scope. I've only personally seen the 4 millimeter scope due to the fact that it has double the cross-sectional area and capacity versus a 2.7 millimeter scope. We keep going on to the next slide. We're going to talk a little bit more about the arthroscopic anatomy of the ankle. So in the image here, you'll see two portals, and these two portals are the most commonly used. You'll see the anterior medial portal and the anterior lateral portal. There's issues on the structures that are near both portals, but with the anterior lateral, this portal is very close to the medial dorsal-cutaneous nerve and its branches. So in regards to the arthroscopic anatomy, the ankle joint is divided into two distinct zones. So that space between the capsule and the osteocartilaginous surface is termed the capsular reflection, and the space located directly between the articular structures of the talus, fibula, and tibia. So those are the two zones that doctors must take into consideration when doing ankle arthroscopies. So there's a wide array of indications for ankle arthroscopy. You'll have anterior ankle impingement, which is the most common form of impingement lesion. It's found in the anterior lateral aspect of the ankle joint around the ATFL and lateral gutter. The tissue in this kind of pathology is usually firm and fibrous, and it's often adherent to the anterior syndesmotic ligament and the capsule of the lateral gutter. So this term has sort of had the nickname or the street name of the lateral gutter syndrome. Another common indication for ankle arthroscopy is your posterior ankle impingement, which commonly noted where the posterior inferior tibial-fibular ligament and the inferior transverse ligament sort of impinge on each other, causing the patient to experience a rug in front of the door mechanism with ankle plantar flexion. Also, while I was watching the ACFAS video on ankle arthroscopies, I noticed that Dr. McAllister listed quite other complications that might occur, but we'll talk about that when we get to the complication section. But other indications for ankle arthroscopy are arthrofibrosis, infection, loose bodies, osteochondral lesions, and synovitis. So complications. So complications from arthroscopic surgeries can occur from anywhere from 8% of the time to 17% of the time. But according to Dr. McAllister in the ACFAS video, scope complications in ankle arthroscopies usually only occur in 1.7 to 9.8% of the time. So The most common complication that we will see with ankle arthroscopy is local nerve injury. So each of the neighboring nerves and their branches are susceptible to injury, including neuropraxia and reflex sympathetic dystrophy, which is termed RSD. So according to Dr. McAllister, the most common complication is neurologic, and it's due to some sort of impingement or disturbance of the medial dorsal cutaneous nerve. Moving on, another complication that we'll see commonly with ankle arthroscopies are synovial fistulas. So this complication is solely strictly based on some sort of arthroscopy surgery. A synovial fistula is a non-healing portal wound that drains synovial fluid. So while I was reading about this in Montgomery, some of the treatment options for synovial fistulas are local debridement and formal suturing. They usually respond very well to that. But there's also new research coming out that states that early weight bearing in a patient after an ankle arthroscopy surgery can lead to the development of synovial fistulas, which I found super interesting, as there's not a lot of research like behind this yet. So another type of complication that's strictly unique to arthroscopies is instrument breakage. So that's like your cannula breaking or your scope, etc. So other complications that we might see in ankle arthroscopies are hemarthrosis, infection, thromboembolic diseases, local aneurysms. We also see like ligament injury, tendon injury, anything, all the structures near the portal site can get hindered or like damaged in some way. There's a lot of portal sites. I know I only listed two, but those are just the two main common ones. Yes, that wraps up my presentation on ankle arthroscopy. I just want to say thank you so much for your time, and I look forward to next week's presentation.